Are we ready? We'll stand for the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
First order of business is our minutes. Motion for the minutes.
Motion.
Any discussion or amendments? All those in favor? Any opposed? Okay. First resolution is the resolution authorizing our chairman, who's here gratefully, thank you, to enter into agreement with Oswego County Opportunities for the Call and Ride program. So I'll look for a motion and then we'll discuss it.
Move it, Mr. Chairman.
Any second?
Second.
Sarah, did you want to address it a little bit first, or?
Certainly, this is an ongoing, it's just reauthorizing the agreement that we do have with OCO for the Call and Ride program. In 2015, we came into some additional funds from the Community Services for the Elderly. We were able to put those funds towards transportation, towards the Call and Ride program, which is an established program. Our seniors are able to utilize that program at no cost. It's a voluntary contribution. And it is very well received, well used. They wish that it was available more days per week, but for the days that they do have, they can have up to 3 trips for this one-way trip. So from their house to the grocery store, maybe from the grocery store to the pharmacy, then back home, so 3 trips. But it's not just for, it can be for personal visits as well. So maybe they want to go to a family, to a family member's home as well. An average, the rides to date for this current contract that's expiring the end of March, it's on average is $5.15 per ride. So, and that's anywhere in the county. It is just in the county.
And there's no limits, like some of the regular routes, there's no limits to where they go. Is that correct? Or is there?
It's limited to certain days of the week, to what area, what school district you live in. So they do limit it to where you live as to when you can utilize it. But it does not limit it within the county. So you could, doesn't matter if you're in the county, if you're going on a day that the bus is in your area, you could go from Oswego to Pennellville or to Pulaski or wherever the case may be. They don't limit where you can go to.
And who does the dispatch for that?
OCO does that. So the calls do go into OCO, they do an intake for the information that we do need to get reimbursement, and they provide us with that information monthly.
And when was the last time this was put to RFP?
This was never put to RFP because it was an established program. We're just contributing to a program that was already established.
And it's a 1-year contract.
Yes.
Other questions? So there's no, how many years have we done this with OCO?
So this will be coming on our 5th year. We started in 2015.
Yes.
Yeah, thanks, Roy. We've always talked about, and I know Legislator Castillo before he left, we always talked about, what are the shortfalls for expanding it to more days? It's just purely monetary, or?
It is, and Call and Ride runs in the red. So it would be a substantial amount of money if they were to look to increase anything.
Okay.
It would be probably astronomical, probably not.
Okay.
I would love to see more days because they're in the APW school district as well as the Pulaski school district. It's only twice a month because there's not a lot of ridership in there. So I'd love to see it more frequently. But
And just a follow-up, is this funded through local share? Is there state money involved with this?
it's all state money.
Okay.
There's no local share as a contract, or the agreement is OCO has to put up the 25% match. So they match that amount for us.
So when, as we're starting to work with the mobility management team to talk about how we're doing things in the county, then since OCO's doing the dispatch, they'll be intimate in that discussion about how we can either make this more efficient or have it be available to more people more often.
Right, if,
or
once
some
the,
version of this.
yes, once the mobility manager is all in place and we have the senior volunteer corps, or I see maybe shifting the money from OCO call and ride maybe to that, so that there's not the limitations that the call and ride program has. Maybe not all the money, but I see shifting some funds towards that.
Any other questions or discussion? So the total, there's a monthly payment. That's or is that flat? That's a flat monthly?
Correct,
And the
correct.
contract is a not to exceed 20, but then there's, what's the additional 7K to take it up to 27,000?
That's the match from OCO,
Match from OCO.
correct. The 27,000, because the way the CSE grant runs, it's 75%, 25, 75% they'll cover, 25% match, so that additional money is the match that OCO puts in to bring it to 100%. So it's the 25% match.
Okay, I'm good. All right, all those in favor?
Aye.
Any opposed? Motion carries, thank you.
Thank you.
Well, I'll be in touch with you about your email to me, about whether somebody needs to be, at F&P.
Thank you.
I may, ask, Chairman Martino to take a look at this video if it's available in time to hear that portion of the discussion, see if they have any further questions. Okay, HS2. There's a resolution appointing a member to the Community Services Board. Look for motion.
Motion.
22nd. For Melinda Casson. Any discussion? All those in favor?
Aye.
Any opposed? Resolution 3. There's a resolution approved.
I just wanted for folks who are at the table and have not met our Director of Community Services, Nicole was here. If anyone had any questions about the membership, it's the only resolution, so. I have the suicide one too. Oh, and you have the suicide one too, that's right.
Okay.
But this is Nicole Holmes, the Director.
So this is a state mandated body.
It is, correct.
And they, how often do they meet? Quarterly?
It's not exactly a quarterly schedule, but yes, 4 times a year, and then additional meetings as needed.
Any other questions or comments about?
I was just sending the application to guess what?
Okay, so on to HS3 then. So resolution approving the lease of 2 minivans for the Department of Social Services. Look for a motion to get this rolling.
Sorry.
Yeah, first and a second. Questions?
I think it's a good first step. When we go to the hospice, I think it's time to do it with this and see.
Stacy, did you want to comment? I'm sorry, I should have let you have a bit.
Well,
It's budgeted. This is something we've been working on for a long time. We think it's gonna save money.
I mirror legislator Krasik that it's a good first step for DSS. So Enterprise is been brought in over this past year, provided some presentations to us at DSS. We are paying for a driver to drive over 12,000 miles a year. Enterprise will be cost savings for us. If it's less than 12,000 miles a year, we would not realize cost savings, although there's other reasons to do it in terms of liability. Right now, all at DSS that have to drive in the community for their positions, particularly caseworkers, are using their own car. So they're using their own car to go out on a Saturday in the middle of the night with law enforcement, remove kids, put kids in their own car, and go to a foster home. So there's a lot of liability our caseworkers take on by driving their own vehicles. So it's a good first step. With a new parking lot, we're hoping for more.
Yeah, and it's really gonna be a better look for the county as well in those kinds of situations, have an official looking, nice looking vehicle and, not just somebody's car and, geez, I gotta move this stuff out of my back seat to get you.
Pictures in there, all that.
And Stacy, we be tracking it similar to what you did with individuals you're driving now, cars.
Yeah, actually, yes, and with VTC's new system coming into our midst, there'll be a GPS in their tablet that will automatically take care of mileage. So VTC will also be tracking the miles for this.
Very good, thank you.
Oh, sorry, Herb, go ahead.
Where would the vans be stationed all the time?
At this point, it would be in our parking lot, although we have discussed bringing to Board of Legislators a request to waive the policy and allow people to have county vehicles at home. I haven't had the opportunity to discuss that with Legislator Rehill and with Phil yet. So it is something we're kind of looking at, how does this all work for us? This is the first time we've had this. I know that there's protocol about not having vehicles at people's homes. So I'm not sure how that's all gonna work out.
There are criteria that an employee has to meet in their job requirements in order to be eligible for a commuting vehicle. That's all in the vehicle policy. Just take a look at it, see if it's going to apply or not.
Okay.
It's not that it's waiving a policy, it's in the policy. It just establishes criteria for whether it's makes good business sense and financially in the best interest of the county to have a commute rather than stage.
Okay.
And previously, when I worked for the county, my vehicle was at the airport. So it was only 3 miles from my house to the airport. They talked about putting it there or putting it at the county building in Fulton. There's other highway garages. So it's possible that if you have somebody that you're gonna use that doesn't meet the criteria for that, that could be a discussion, is can it be staged at another facility?
The closest municipal building maybe. Yeah, okay. Thank you.
Tom?
Steve, I'm just having a little bit of trouble following the funding. So where are we funding this out of in the budget? And is any of this reimbursable? Or Veronica?
Veronica, is this a pop quiz? Do you want me to take it or do you want to speak to that?
You can, if you want.
Okay, yeah, so, so this is, a contract and it is through, reimbursable. It will be a 60-38 split, so the local share, for each monthly lease would be the 38% of, $398.05. And where does it come out? We don't need any additional money. Do we need to create a line though?
Yeah, we have to create a line because we don't have an automobile line right now in the DSS project because we don't have any automobiles.
Right. But we're gonna, pull it out of the mileage line.
Correct, we are taking it out of mileage because the 2 people who will take these vehicles are being paid mileage currently and they will no longer be paid mileage.
Okay. You know, I just didn't see a memo.
Budget mod,
Yeah.
no.
Okay. So
We
is
don't
this,
need a budget mod because we're not,
okay.
it'll have 0 impact on the budget. Well, we're hoping it has a good impact on the budget, we save money, but.
You'll need a budget mod to move money from mileage into a new line.
Yeah.
But I think the amount is enough that I can do that without bringing it through the legislature.
That was the issue, wasn't it? Yes, now I recall, yes, it was a small enough amount, it didn't need to go before the full BOL.
Yeah, it's
Right.
already done, it only needed filled.
Gotcha.
So during a single year, the use of that particular van for 12,000 miles is where that's the click point at which it's going to start paying benefits.
That's what Enterprise has researched, correct?
Okay, and do you have a sense of how many miles your individuals have been driving in their own cars, or?
Well, the two that were tapping to drive these two would be at least,
Between 20 to 24,000
Yeah.
miles a year on
I was
those.
gonna say about double it.
On their own cars?
Yeah.
Oh, it's in total?
Yeah.
Or between how many people?
Two.
Just two?
Each person is over 20,000 a year,
Yes.
Wow.
20,000 miles a year they travel.
Correct.
I had a job like that once, I loved it, my mileage check was as big as.
Yeah, well, that's why I think the treasurer likes this idea.
We have between 6 and 8 people who are doing in excess of 20,000 miles a year on their cars.
Okay. Other thoughts, questions? I think it's gonna be a money saver. So look for a vote. All those in favor?
Right.
Any opposed? Motion carries. Thank you. HS4 is a resolution awarding professional services contract suicide prevention coalition coordinator services. Why don't we look for a motion first and we'll discuss. Second, anyone? Brad? Go ahead.
Sure. The Oswego County has had a suicide prevention coalition longstanding for a number of years. It has floundered a little bit back and forth with different degrees of participation from the community. Of recent, we've had a much stronger, much more robust coalition. Unfortunately, it has really been on the shoulders of my staff to really operationalize the efforts of the coalition. And so last year, we had decided to look for funds within our budget to be able to purchase essentially a part-time coalition coordinator to help really launch the efforts in the community to have a much more positive impact and be much more involved and recruit additional coalition members to have an impact on suicide prevention in Oswego County. So we put out the RFP and received 2 proposals for a part-time coordination. One was from Oswego County Opportunities and the other one was from Farnham Family Services. The document that is in your agenda packet recommends the award be given to Farnham Family Services, who is also currently runs the Substance Abuse Prevention Coalition for Oswego County and has been successfully doing that for the past 4 years. And they have some existing staff, including a part-time staff person, that they would use these resources to create a full-time position for that individual, so they would be supporting both coalition efforts in Oswego County. Part of their proposal really was drawing together the 2 very different but connecting issues of substance abuse issues and suicide, and mental health issues that are directly connected between the 2. So our review committees is recommending the award go to Farnham Family Services in the amount of $52,770 a year.
Open the floor for questions.
Yeah, thanks. Who, has Farm always had this contract? Or was it typically OCO before them, or?
This contract,
This
this is
one's-
brand new.
Okay, brand new.
This is the first time we've done this.
Okay, thank you.
How many suicides do we have?
So, well, last year there were 12 last year. And it's been increasing, it goes up and down a little bit, but we have one of the highest suicide rates in New York State. We just recently had one of
Young
the
man.
Fulton students.
Where's the funding come from for this? How does this?
It's out of New York State Office of Mental Health funding that we received.
Okay, so
Right,
it's-
and it's already budgeted in the 2020 budget and our plans to do this. So essentially, it was just looking at ways that we could allocate funds that we were already receiving to be able to make this happen.
So we don't have the actual RFP, so the scope of work, you guys will be tracking that in your office. Will you be, how often are they gonna meet as a coalition? How's that gonna work?
Well, there's an existing coalition that they'll take over the structure for and do additional enhancements and development for. And my office will still be very heavily involved in the coalition, will just not be responsible for the coordination activities. So we'll be directly monitoring their activities, and they will be doing progress reports to my office.
Any other questions? Go ahead.
Is this gonna be a 7-day, 24 hours a day post once it starts using?
No, I'm sorry, the question was again, I think I was reading.
Call takers, they're gonna be on around the clock?
That's not what this is. The Suicide Prevention Coalition is an establishment of local stakeholders that are working on strategies to have an impact around awareness activities and education to try to prevent additional suicides in the future. There are other services that are 24/7 crisis lines for people who are in crisis or feeling suicidal that they can contact, as well as a mobile crisis service that operates on evenings and weekend hours currently.
Any other questions? All right, we'll look for a vote. All those in favor?
Aye.
Any opposed? Motion carries. Thank you.
Thank you.
Resolution 5, it's a resolution authorizing budget modification, additional hours, employment, and training staff for able-bodied adults without dependent children, supplemental nutrition assistance program. For motion,
I'll move it for discussion.
second by Brad. Why don't you, give us a little brief on that, Stacy?
Yeah, in my updates, Gidget Stevens, our Director of Financial Assistance, and Christine Weaver, our Director of Employment and Training, are here to talk about ABOD and the impact on our day-to-day operations at DSS, because it will be significant. At this point, we are requesting additional hours for our employment and training specialists to keep up with the workflow. Chris advised me this morning, they've thus far done 11 groups. You may recall my brief last month that we've got a little more than 1,100 clients that is under ABOD. And we're bringing them all in groups of 50. So don't come visit DSS because you think the parking was bad before. Whoa. Yeah, it's been a little wild around that block or two.
So you're trying to bring the 50 in at a time
50
in person?
at a
Christine,
time.
why don't you come on up to the table for a second?
We have to catch up first of all, because when the requirement's going to affect on April 1st. But the customers that are impacted by this change have to actually be in compliance on April 1st.
In compliance on April 1st, okay.
So April is their first month and Gidget, feel free to jump in. So there's
There's a
roughly.
seat there too if you like.
There's just about 1,100 people on the current SNAP recipients who are able. ABOD is the age of these adults without dependent children. And so there were about 1,100 people that the district's responsibility was to inform the individuals of the ABOD requirements, to educate them on exactly what they have to do and then to offer assistance. And so to try to get the groups in, we started scheduling orientation sessions. We were scheduling 50 at a time. The show rates are not high from those. And then once people are there, we have staff, we're doing sessions in both offices. So the staff can talk with people about what it means, and then we're checking with them to see if they want assistance meeting the requirements, if they plan to do it on their own. But there's a whole host of other things that have started surfacing that go along with the ABOD requirements, because we have individuals, the ones that are coded as an ABOD right now are technically work rules eligible. Some of those individuals are not claiming work exemptions, which means some work on different staff because we have to notify them, notification has to go out for them to provide documentation. There's some of these individuals that are cash assistance recipients in addition to the ABOD requirements, and the rules are not the same between the two programs. They don't align both in terms of the work activities the individuals need to do. In some instances, it requires separate set of data entry into the system, and other instances it does not. And
So are you like bringing 50 people in and putting them in a room and then sort of briefing them and then going through like individually somehow as well? How are you managing that? I mean,
we're scheduling them 50 at a time. They're not showing. The largest group we have is 16 in terms of who actually showed, but there's a canned presentation scripted that staff go through. Then there's a form that they fill out indicating whether they're asking for assistance, whether they think they can meet the requirements on their own, whether they're claiming any kind of exemption, which they require their staff to follow up with after.
And to add to that, those are the active people, so like Stacy had mentioned, we have about 1,100 active, but my staff now is required to educate every new person applying on these new rules and requirements, which we average about 475 to 500 staff applications a month. So our interview times are increasing 10 to 15 minutes, because we have to go through all of these rules that they may have to participate in, which prior with the waiver, we didn't have to do that. So on top of the active population, we are required to educate them at interview, at recertification, which is when they're reauthorizing their benefits, and anytime they change their status. So if they were exempt, as Chris indicated, but then something changes in their life and they're no longer exempt, now we have to reach out to them, contact them, notify them, and call them into one of these groups. So it's a lot of big
how do they
push.
qualify to be exempt?
There's about 12 exemptions. A disability would exempt you, so if you have a medical verified disability, if you're participating in a drug and alcohol rehab program, you would be exempt. Care for a child under 6. So we have a variety of people that are fully exempt from work rules with SNAP. And then we have some people who may just be ABOT exempt. If you are pregnant, if you have a child under the age of 18, you do not fall into
Okay,
the
so
category.
some of those are different though, because the person that has the 6-year-old is not, already has dependents. So
Correct.
that wouldn't have to do with the SNAP piece anyways.
Correct, they wouldn't have to meet these requirements that we're talking about. But we identified 1,300 people, actually, the last report was a little higher than the original, because we're pulling reports monthly. And like Chris said, the biggest push is right now, because we have a whole population that has been exempt since 2015, that we are now needing to catch up on the education.
Okay, so the big chunk of this work is because we have to do this 1,100 right now, and then the ongoing piece is educating every new person that applies.
But
On Gidget's side.
On my side.
But
yeah,
on
Right.
A&T, not so.
on my side, for the people that are requesting assistance, we would have to schedule the work activities, monitor, get timesheets, enter. For those that are not requesting assistance, we still need to collect documentation from them of how they met the requirement, because they can meet it through work, they can meet it through volunteer work, they can meet it through in-kind services, they can meet it through community service. But the district, while we're not required to assign them to those activities, we are required to collect the documentation and enter it into the system by the 15th day following each month. Right. So the ability, the intent of it in terms of working with people, and having people accountable for the benefits they're receiving makes sense. And the district has always had the ability to work with SNAP, the SNAP population. We never have, because we haven't had the resources to do it. So this is really kind of forcing a segment of that population, the ones without children, but it's not giving the district any additional resources to do it with. Right.
So you get to April 1st and, 400 of the 1,100 don't come in. Are those the ones that are likely to just fall off of SNAP, or?
They may, that's another component that will be the extra work on our side, is we have to track and monitor, because people are only eligible for 3 months of non-participating time within a 3-year period. So my staff has to manually track monthly how many individuals met that requirement. We get reports, and then we would have to close them. So the real impact will probably happen July 1st, because people will get those 3 free months if they don't work. But then we have to every month research and work with employment and training, because we're gonna have people coming in and out that might participate 1 month, 3 months they might not, then they may again, and then we have to close them. So there is a lot of ongoing tracking and monitoring that we see adding to the impact of our everyday work as well.
Other questions?
Well, these people who don't show up, Is there any savings to the county and these people? Are we ever gonna kick them off and stay up?
If they don't show up, their case will eventually, well, it depends on if they submit documentation to show they're meeting the requirement or not. Because if they don't show up at the meeting, but they submit documentation and we can enter it, then they'll stay on. If they don't comply, then the case would be closed. And the local savings with food stamps is all 100% money, so there is no
SNAP benefits
local
are 100%
savings.
back.
SNAP is 100%.
Yeah,
Correct.
100% for that part of it, so there's no local savings on that, but there is savings at the federal level. So,
That's why they did it.
Remember, these are all new rights being pushed down by the
Right.
feds. So, and then into the state, and then, for us to implement.
This is not something similar to what, well, I mean, we have have had an exemption for how many years?
several years, we've
The
had a
waiver?
waiver for the ACOs.
Since 2016.
So it was before that, it was more like this, or it was exactly like this?
There were ABOD requirements in the past that we used to follow. Unfortunately, because of the turnover, most of our staff aren't familiar with them, so that's another impact that we're seeing. We have to retrain all of these individuals who've never heard of ABOD. But yes, this was a requirement back in the early days of welfare reform, when the original administration went through.
Any other thoughts, questions? Okay, and this is actually coming out of the budget, it's not coming out of the reserves.
It's a budget
Now,
transfer.
I believe there was, a request for, so this is in, remember, this is in our employment and training side of the budget?
Mhm.
So that's separate in the budget book?
Oh, so that's the interfund,
Pricing, yeah, okay.
And so, it would increase the local share. $1,683. Reimburse 50%. So once this dust settles, I expect another wave. States that have gone through this, some states did not even accept the waiver to be, they accepted it and then they got rid of the waiver. Somewhere's, probably what we can expect is somewhere's between 60 and 80% of those 1,300 people are going to fall off and never come back. They'll be gone, never come back. They won't grace our doorstep anymore. Most of those are probably people who are getting SNAP only and working under the table. I mean, you must know, we all know, right? There's this whole underground economy that happens in every community, not just Oswego County. And they're not reporting that. Then there's going to be those that are really desperate, couch hopping. The EBT works right now. They're not keeping present. They don't open mail. There's chaos in their lives. Some of them are undiagnosed mental illness. Those folks, they're gonna go to swipe their card in July, and they're gonna go, doesn't work. And they're gonna run right into our door. And so we expect a whole nother wave to hit us this summer by people who all of a sudden realize they don't have SNAP benefits anymore. And then there's going to be folks who are working 18, 19, sometimes 20, but they're not gonna quite meet that 80 months or 80 hours in a month requirement. And we say that, 80 hours in a month, but please know, each and every one of these cases is different because it's not actually a clear 80 hours. Depends on how much they're making in those 80 hours a month. It depends on this. This is bureaucracy that is beyond belief. This is mouse click, mouse click, mouse click, mouse click, mouse click. This is crazy, but it's what we have to do. It's the system that the feds and the state gives us. And so if we want our folks to be able to have supplemental nutrition assistants, for those that really are working hard and worthy, then this is what we have to do, mouse click, mouse click, mouse click. Chris is really predicting, and I agree, that we will probably see at least 150.
I'm guessing.
Yeah.
It is a guess.
It's a guess, but out of that 1,300, 150 who really are desperate and want to keep those food stamps and will do whatever they can, they're already working. So how do we, as to quote Chris, giving them meaningful service to give them that leg up and get them a full-time job? Is it transportation that's the barrier? Is it childcare? Is there something we can do to help strengthen so that that family can actually be self-sufficient, or that adult can be self-sufficient?
Just a clarification, the 150 I'm talking about, there's 95 individuals that are cash assistants and SNAP that are ABOT right now. There are also roughly 150 that are already working, so those I think will continue to stay on, so it'll be closer to 300, but 150 new that we were working.
Right.
Yeah.
So,
And that is not, we do not have a deep bench. We don't have the capacity in Chris's shop to keep up this work over the long term. Once we have to really dig in and start working, that 150 families are added to all the other families that our employment and training specialists are already working with, and successful. You know, I mean, the other thing is, if the clients meet us halfway, we can usually figure things out and be successful in providing a path to self-sufficiency.
That's the goal. Any other questions? All right, we'll vote. All those in favor? Any opposed? Thank you. All right, Brian, you're up for department report.
Alrighty, okay, I'm gonna give you some, quick updates. So the last month, I was in Albany, so I wasn't at the meeting, but the, Governor's Youth Council, the state, picked their winner from each county, and really is today, as late as today, I just received the name of the winner, who will represent Oswego County on the Governor's Youth Council, and I'm sure you've worked with the state before, I can't release that name at this point in time, because the governor's office is gonna do that. So, I can't really share that information right now, but we do know that Oswego does have a representative that's been chosen to represent. So what they're gonna do is they're going to meet, the governor's putting a committee together where our youth, there's one from each county, will, go to Albany, they will meet with the governor's office and talk about different things that are impacting their community. And then, as the regional rep for Central New York and the Southern Tier, I will meet with them quarterly to work on other things that they're gonna do to bring to Albany. So stay tuned on that one. As I mentioned, I did go there last month. I brought 6 youth from our county. We got to meet with all 3 of our elected officials. It went very well. Assemblyman Barkley actually took the kids to the floor and they were introduced on the floor. So kind of a little shout out there while we were there. I have some things I'm gonna hand out to you quickly. The Youth Career Summit is coming up in May. We have all 9 school districts committed to being a part of it. It is a activity where we have about 800 8th graders from across the county go to learn about opportunities that are in Oswego County for careers. Each year we try to fine tune it. We have over 50 different businesses committed to being a part of it again this year. And as we continue to brainstorm to look at different careers that our youth are interested in, one of the most intriguing new careers that we're going to have is we're going to have drones there this year. And the people there can actually fly the drones inside the college, so that ought to be interesting. But that gets the 8th graders and keeps their attention as they move forward. I also wanted to give you guys a quick update that our webpage is up and running and new for the county this year, which has been really good, is we now have online registrations for all our parks and our campers for Camp Hollis. So since we went live, I believe on Friday, it's already being accessed. So people have the opportunity now, should they choose to sign up their child to go to Camp Hollis online, or they can still do the traditional paper trail should they like to. And it's the same thing with renting the facility. So in the long run, When we look at, cost savings, I think these are a couple different ways that we will be able to increase our numbers without having to use a lot of paper. Couple things on our grants. We got 3 big grants in 2019 and where we're at. The READY grants, which are for the water on Lake Ontario, the one at Camp Hollis and the one at Camp Serby. There's a 10% engineering report that the DEC had to approve. They approved both of those as of this morning. So that pushes us to the next step with that. And our CFA to winterize Camp Hollis, that is also all been submitted to New York State Parks and Rec, and they are going to do an on-site visit, which they're setting up right now to move forward with the planning process. So both are moving well. I have about half of our staff has been hired for Camp Hollis for this year, but we still have some open positions that we're looking to fill, and I was just going to pass those around in case you get approached by anybody that's looking for a summer job or anything to go forward. There are some openings to work at camp. Of course, our lifeguards seem to be the hardest to get, so if you know anybody who's interested in being a lifeguard or becoming a lifeguard, then it's a great opportunity to work at camp this summer. We're also looking for some counselors that you'll see on there. All right, and then also, I'm not going to move on to that with you. On Wednesday, we have our second phase of our Oswego County T1D, which is our type 1 diabetes group that will be meeting at City BOCES. This time, they're going to be learning about eating healthy and what they can eat and how they should eat. We'll be working with Cornell Cooperative Extension, as well as we have an agency, Kristen's, which I think is a caterer at Battle Island. She'll be there as well to talk about different things that our families can cook healthy for the children with diabetes or even adults now with type 1 diabetes. Last week, our RHY task force met, and we included all the McKinney-Vento representatives to brainstorm with them on different ways that we can all collaborate to work together to potentially help each other. And one of the important pieces that came out of that is to get a universal document that they can use for residency within their schools, because they are using different documents in some school districts. More than others seem to be collecting the data that's needed. So we're working with them to hopefully put together a universal document that will help to do that. And lastly, I tried to save on money with our new printer, but with it being a new printer, it printed the same thing on both sides. So there's only 5 copies here instead of 10, but we're also doing on May 9th, there is Friends Camp House is going to be doing a color run. That's why it's so bright. So if you choose that you want to go run and have colored chalk thrown at you or something while you're going to do that, Friends of Camp Hollis is putting that together as a way to help with the scholarships so that no child is denied funding to go to Camp Hollis. So I think that's it without taking up a lot of time here.
Brian, are you scheduled to go to the Mexico Community Connection on the 21st?
We are.
Okay, very good.
We are, and
You want to share this one?
Yeah.
we will be in at CCC the next 2 days as well. But yes, we're pretty much up on all of them. I know Mexico definitely.
Okay, good, thank you.
How many schools did you get to participate in the youth summit this
I
year?
have 8 committed so far.
8 out of 9 districts.
The 9th one, I have people that work there that are going to push for them. They just haven't responded. So we have 8 out of 9 committed.
Good.
And we have, like I said, we have over 50 different agencies who are going to be there. So it should be.
Any other questions for Brian? Do you have anything else, Brian?
That's it for now.
Okay, thank you. Department of Social Services is up next. Tracy?
So, we talked about AVOD, and I want to continue that discussion because I recognize that the Board of Legislators have been very supportive of us at DSS and where our pressure points are in providing additional staff. We received the 4 additional caseworkers and the additional attorney and paralegal this past year. But this is another heavy lift for us, and I just want to make sure that you hear really loud and clear that as the Commissioner of Social Services, I feel compelled to bring another position before you. I'm trying to hold off as long as I can to let the dust settle a bit. And frankly, to see how the state legislators are going to resolve the governor's issues regarding Medicaid. So we're doing the best we can to keep our head above water. I do anticipate that without another position, another employment and training specialist, that we would be looking at even more additional 5 hours. You know, we've already got, if you recall, people working 40 hours in order not to hire another employment and training. They're doing the groups, refresh my memory, Chris.
The workshops.
The workshops that are mandated. So we are already having some of our folks at a 40-hour work week. Depending on what ends up with ABOD, we may be looking at time and a half for overtime as well. You can only fit so much into these extra 5 hours. So where it becomes the set point of using existing staff versus having another staff member assigned just to this ABOD population, we're trying to be as cautious moving forward to ask for another position as we possibly can be. But I did want to make sure that you had the heads up that there's not a way for us to keep up. Our folks are already pretty exhausted. You might have noticed we've had more turnover in that division than we've ever had in 30 years in the last 5 years, would you say, Chris? So right now we're down 2 employment and training specialists.
There's still one, yeah, there's this position, yeah.
And then we've got both supervisors, one retired in September, one's retiring in March, and then Chris's retirement is end of June. So this is also, I think, some folks who are feeling the stress of the leadership transition. Chris Gidget, is there anything else that you want to let our committee know regarding ABOD?
The thing I'd say is just that probably the most difficult part about this is that the rules are different from the public assistance program rules. And both how you assign people, what activities count, where you enter it, as well as the process when people don't comply. Normally there's a conciliation process. With ABOD, there is no conciliation process, it's a closing. And so that's what's making it a little bit more difficult, I think, for staff. Because they've already got to know 2 sets of programs, the TANF and the safety net rules. And when you add ABOD in addition, it's just very confusing to staff. It's confusing to me at times. I have to keep going back and re-looking at things. So, Richard, I don't know if there's
You said
anything
you're
else.
down 2 specialists now?
One was a vacancy that this young fellow went over to the DA's office as a paralegal.
And then
Liz's
vacancy, which
and
is
then,
for Thursday, I think.
yeah, Thursday we should be hearing about the filling of the other vacancy, and that was due to a promotion.
So when we get those positions filled, I mean, that may help as well.
This is adding workload on top of, those positions, Liz, the vacancy that's coming through on Thursday is the refill too. Liz has been trying to maintain her caseload while learning Nelson's job, which has been challenging for her. And so this is a refill to the employment specialist position. This is also a critical time for us because the summer youth employment program is starting up. And so, we'll be processing 350 applications. There's only 2 people assigned to that youth team. So we just don't have the manpower within the unit.
We don't have a deep bench. We don't have on the WIOA side, 0 local share. Remember, we're bringing all that WIOA, and if I wasn't clear, WIOA, all those programs under, those are all non-mandated too. The feds don't, or the state doesn't say, we have to take that money here. But it's all 100% federal money. There's no match to it. Why wouldn't we? But those are heavy lifts. So there's that side of the house, and then the welfare to work side of the house. And with SNAP, we only get a 50% reimbursement of our manpower. We do have an allocation that's 100% employment and training SNAP, but it's small. Veronica,
$5,000.
yeah. It's amazing how she can just pull that right out of the budget book in her head. I'm very concerned because these are folks who are pretty volatile at times. Our clients seem to be getting more and more unpredictable. Their behaviors are unpredictable. So,
I think one of the things too that we have on our radar is, like Chris said, the rules are different. And we typically see a population of individuals who only apply for SNAP, these single adults, and manage to make it otherwise. So my division will be monitoring the impact on safety net applications, because if people start to lose that $195 a month they were getting in SNAP benefits, they may opt to now apply for a cash benefit to help meet that need, which is a local share, which right now we're not seeing. So starting in July, our plan is to monitor a potential increase in safety net impact because of the loss of the SNAP benefits.
you know, keep in mind, these are some of the folks who you might see picking up cans and bottles alongside the road.
Right.
That's how they get money. So these are folks who are probably have always been marginalized and have a very, very tenuous tie to kind of mainstream labor market. Because if they had a tie to mainstream labor market, we'd have them in a job before they ever received one single check.
Right.
And we do all the time. I mean, we divert a lot of our applicants. They never even get opened. They go fast track right to a job. So we divert a lot of people out of our system.
Okay, further updates?
Since I saw you last committee, Carrie Benzing has left. I'm now the interim director of services. I can tell you, putting in way too many hours. I'm tired. There's a lot going on in services right now. There's some really tough cases. We're having some real challenges with family court. I've been called into 2 judges' chambers already. We've received 2 violations of court orders on the DSS side. I'm working through all of that. I have a meeting this Friday with Judges Nelson and Benedetto. I guess Judge Nelson would like County Attorney Mitchell at the meeting. I'm not quite sure what that's all about, but I'm doing my best to keep up with all of that. But it's a very heavy lift right now. We are recruiting. I am not finding good, solid candidates. Candidates that I thought I might be able to solicit some interest in the positions. It's just such a low pay for the responsibilities that are shouldered. You know, we're talking in the 60s. But I'm finding the same thing in trying to hire for Chris's retirement, because that's, you know, again, low 60s. And the consequence of error in both of these director positions poses a lot of liability for the county and for me as the commissioner. So just putting a warm body in there is not going to cut it for any of us. I don't know what to do about that yet. I'm biding my time. I'm continuing to recruit, continuing to work with Julie Berry. You might have remembered me talking about one of the difficulties with, let's It's not Julie.
Bell.
Bell. I'm so sorry. I didn't know Julie. Bell.
She's not here.
Sorry, Julie. With Julie Bell and Marty, to come up with some good candidates, but, right now, again, it's not just the pay, the low pay, but also, benefits. You know, before, government benefits were looked upon as a good thing. Since the changes, that took place in 2012, people don't have time off for 6 months. They don't have insurance for the first 3 months. You know, all those things create obstacles and barriers for me in terms of recruitment. With the director of employment and training, Chris's position, it's not tested. It's a non-competitive position under OPCA. But the director of services position is tested. So I would have to hire provisionally. Last time we did this with Carrie Benzing was 3 years ago. She was with us about 2 years. So 2 years ago we did this. She was seated in her office for, I think, 8 months before she actually took the test. So we weren't able to really make her permanent until she had been with us about a year. Carrie was willing to take that shot. But that has thwarted some people saying, you know, I gotta take a job, and if I, you know, for whatever reason, I'm sick the day of the test, no, you could take it again. No, it's just a turnoff for a lot of professionals that I've tried to reach out to. So, you know, I will keep you posted. I'll let you know. It could be that I'm going to have to put somebody in there at some point that I don't have the utmost of confidence in. If so, I will try to bring maybe a consultant in or two that could shear that person up a bit. So Julie Bell and Marty are trying to go through the state and get that director of services test removed from it. I don't know where Julie Bell and Marty are at with that, but.
They have to go through a hearing in order to make a position non-competitive if the civil service exam exists for that title, which can sometimes take several months. Julie did get a verbal that they thought it made sense, and we're hopeful with that, but very often when it comes down to the actual decision, it will revert back to a no. So we don't really know what to expect on that front at this point.
And then the only other thing I had was, I wanted to let you know, I did meet with the new executive director of the Child Advocacy Center, CAC, and some of the board members. We had a really good discussion. I think things are moving in the right direction there. Tori and I have been kind of working through some issues between our teams. So I'm very optimistic that we will get back to where we need to with a focus on really with that MDT, it's the most serious sex and physical abuse cases with these families. And some of these cases, I mean, I've been in, it takes a lot to kind of shock me after 40 years in this field, but lately, I just sometimes can't believe what I'm hearing. You know, it's just truly some difficulty. There's an agenda item for the next commissioners gathering in Albany. And we're going to be hopefully connecting to the directors and commissioners of the state agencies about kids being left in emergency rooms in hospitals. We have an Oswego County young person who has been at Upstate's 7th floor since December 2nd. And we cannot find any place that will take her. much trauma, much abuse in the background, developmentally disabled, mentally ill, 2 armed guards outside the hospital room door. So basically, this young person's in solitary confinement. And we cannot find, we have put referrals into every residential facility. The state continues to close down OPWDD beds. They continue to abdicate their responsibility to these kids. So now this kid is gonna end up a child welfare kid. And the soonest opening that we can find right now is a bed in a private facility in Florida. Makes home visiting complex. You wanna talk supervised visitation and transportation, whole new level, right? Crazy, isn't it? Florida. Every single week, there's a hard to place phone call every week with Oswego County, Upstate, Hutchings, and all the big cheeses from the state agencies. And how far have we gotten? They just got through the SPOA application, which should have been done, as far as I'm concerned, 87 days ago. OPWDD doesn't want to take responsibility because of the serious acting out mental illness. OMH doesn't want to take responsibility because the OPWDD. And how long have we been singing this tune, Phil? The 40 years I've been in this field, we've been singing this same tune. So somehow we have, got to get, because that's not cost effective to send a kid down to Florida. But keep in mind, what's also pushing me on this stuff is that Families First Preventive Services Act. Remember last year, the slide, congregate care down, foster care up. These foster homes are not equipped to take some of these kids. They're just not. We're gonna have a tragedy in America someplace. There's no doubt in my mind, by not providing the highest level of care that some of these kids deserve and need. So. And that's it.
Alrighty. Jamie, Veteran Services, you're up.
All right, good afternoon, everybody. So for the month of February, our office processed 127 claims, which is huge considering we're averaging, for the new year, this past quarter, we have 73 new veterans, which means that those are veterans we've never serviced before. We've seen a huge influx in new veteran traffic, which is a positive. Our office has been extremely busy. So in March, on March 23rd, Congressman Brindisi's office, in conjunction with Congressman Katko's office, are going to do a Vietnam veteran welcome home ceremony. They have their own pin that they are going to pin on any Vietnam War veteran that wants to attend the ceremony. It's going to be at the VFW in Mexico. 10 a.m. is the arrival time. So as soon as I get some public service type information to send out, I'm going to do a release to get that disseminated to everybody as quick as possible. It's a short turnover time, but we have one of the largest populations of Vietnam era veterans in the state here in our county. So about 87% of our veterans are Vietnam era veterans. It's kind of it would definitely be a good showing of support for us to kind of push for veterans to attend this thing. So I'm going to do the best on my part. I will email out to all the legislators the announcement with the flyer attached. So if you want to try and push that out to those that are in your district, this is county-wide. So again, it'll be at the Mexico VFW. The Veteran of the Year applications are available now on the county website. If anybody wants paper applications for Veteran of the Year, please let me know. I'll get them sent to you via inter-office mail and put in, or if you're a legislator, have them put in your mailbox. On April 22nd, I'm going to be giving a VA programs presentation at Cuba Community College. It's a Fulton campus tomorrow, and Wednesday is the Cuba Community College Wellness Fair as well. On the 19th of March, I'll be meeting with the Syracuse University Law Program. They currently offer a free Veterans Legal Service Program to those veterans who need legal help. Unfortunately, the feedback that we're getting from that program is that they will do an intake on the veteran and then never get back to them. So they're basically, the veteran thinks that there's, motion or that somebody's assisting them with an appeals case, only to find out that there has been no movement made at all. So on the 19th, I'm meeting with them. I'm also meeting with the Syracuse VA Hospital, their interim director, all of the outpatient clinic directors for the area that fall under the VA Medical Center catchment to basically talk about how to improve getting veterans service connected and getting their benefits approved. So what we're seeing is providers are not willing to write what's called a nexus statement to state that they believe that the disability had occurred in service, but they're willing to say that to the veteran. So they're not willing to write it because of whatever fear of liability they may have, but they're willing to tell the veteran to go apply for the benefit, but they won't support the veteran's claim. So we're gonna sit down and have a meeting of the minds to try and figure out how to better facilitate getting these veterans benefits. There's also a huge lapse in providers. So to put it in perspective, there is no female, what's called a compensation and pension examiner. So if you have a female veteran who is claiming military sexual trauma, they're getting examined by a male provider. There's no female provider within our region. So they've been sending veterans to Albany, which is a huge haul. Or they'll send them to Buffalo, which is, equally a long distance drive. Right now, there's only one mental health care provider seeing PTSD patients for benefits purposes twice a month. So we don't, even though our VA medical center is in the top 10% of the country, it's still severely lacking in qualified medical practitioners to help facilitate assisting these veterans in getting benefits. So there's a meeting on that we're going to have as well. So lots of things are in motion. Again, we're seeing huge influx, which is really good business for our agency. There has been, this weekend, there was a significant incident with a homeless veteran who was injured and was squatting in the Burn Dairy parking lot in Fulton, or not Fulton, sorry, in Phoenix. I got to witness a broken system, which is really unfortunate. It was firsthand. The emergency responders did not view it as an emergency. If you're in your car, you're covered, you're sheltered. Ambulance wouldn't force him to seek medical attention, even though there was a head wound and he was covered in blood and obviously needed medical attention. So it was a very eye-opening experience. I did call 211. The response there was good, except I couldn't get the veteran to take any sort of care whatsoever.
Good to hear though, thank you.
Yeah, which is unfortunate. So, but there's a lot of issues there that need to be addressed. So I will say in this room though, if you have a veteran that goes to your agency or comes to you, don't be afraid to contact me if it's not, if it's not business hours. But what I do want to stress though is like we all have personal phone numbers and personal lives that if you give out somebody's personal phone number, they're now all of a sudden accessible, not in the capacity of being a director, but they're now accessible in their personal life, which is, not exactly anybody's idea of, work-life separation. So send an email, contact me if your agency knows that a veteran is in distress and doesn't choose to contact the agency though. I think that's a disservice to all of us working together as county organizations. So I would definitely like to see that happen more. This veteran had been in contact with one of our county departments on 4 occasions, and not one of those occasions warranted anyone to contact my agency. So, but that's all I have, and I appreciate everyone's time. So thank you.
Well, it's possible he didn't identify himself as a veteran though, too.
Oh no, he did. He was covered in veteran clothing. The phone call I got on Saturday to my phone number was, "Hi, this is so and so, the manager of such and such, and I have a veteran that needs your help." And it
At
was,
least that person knew to make that call.
Hmm?
But at least that person knew to make that call.
Right.
Well, I'm sort of assuming that your uptake to a degree is because the word's getting around that you're doing a good job over
thank you.
there. Any other questions for Jamie? Thank you. Sarah, how's the aging? Save the oldest stuff for last.
Well, our senior health fair at the last meeting has said that we're moving right along with the senior health fair, and the date has been selected May 14th, which is Legislature Day. It is at Catholic Charities in Fulton from 10 to 1, so if you do want to go and participate, it is before you have time to get back here for 2 o'clock for the meeting. Some things are out of my control. There were 2 days that Senator Ritchie was available, and this happens to be the better day of the 2 that she'd be able to participate. So the committee went with that over the 28th. So OFA will be providing the meals to the seniors that are going there. We're going to do the congregate meal program. So our office will be registering them, filling out the necessary paperwork so that we can be reimbursed for those meals. Those who have a senior that has a younger person that's escorting them, that they wouldn't be able to go to it without that escort. So maybe maybe a son or a daughter or a younger spouse is bringing them there. They would also fall within the guidelines because they're being escorted, and they wouldn't be able to participate in the event without that escort service. So those meals as well, if they want to participate and have a meal, the program can cover that, and we would be reimbursed for that meal as well. We're anticipating between about 300 people is what we're looking for. And they are looking to provide transportation as well. It's not just an effort for the Office for the Aging, but it's the County Caring Community Advocates, which is part of Rural Health Network. So they're doing some fundraising, looking for sponsorship to have transportation. So as well as many other things, entertainment and such, that'll be there. Again, it's at Catholic Charities in Fulton, plenty of parking, and it is also on the bus route, so regular bus route there in Fulton.
So on an old fart escorted by a 2-year-old that she can eat.
Well, I don't think she drove you there, so
Well,
sorry.
you'd be surprised what she did.
No, so that's a good question. I mean, it would have to be somebody that's making it so you're able to go to the event, not just to go with you to participate in it, but it's allowing you to be able to attend and enjoy the event.
You do know Legislative Day, though, is not about being back here at 2 o'clock. We have luncheon with our students. So it knocks out a good portion of the day.
Is that the main meeting is the same day that you have the students into?
Yeah.
Okay, so I won't expect any of you there then, because that is too much. I didn't realize it was the same day.
I'll
so.
swing by just to irritate you and go to lunch.
No irritation, it's all welcome, so everyone is welcome. March is March for Meals Month. It's a push to bring nutrition awareness to across all age brackets, but certainly we do recognize it in the aging community. The NYSOFA, the State Office for the Aging, is looking at March 18th to really bring awareness on that day to senior nutrition. OCO, our
agency that manages our nutrition program. They are participating, I believe everyone should have received something. I sent the notification to Chris Jones to share with everyone. If anyone wants any more information about it, I certainly will share it. But March 17th, 18th, and 19th, it's, they're looking for community representation, so anybody who would like to participate, whether it's at a congregate meal site or ride along in a home delivered meal route. They're looking for anyone who would like to participate in that. It's a great eye opener. A lot of people, when you go door to door and you bring them their meal and you say where you're from and ask them how they enjoy this meal, and it's great information, and again, it makes you feel good because of how the response from the people that are receiving the meals. So again, if anyone is interested, if you don't want to reach out to OCO, you can let me know and I can reach out to OCO and get something organized or scheduled for you. I will be in Fulton. I'll be going on a meal route and then swinging back to the congregate site and serving meals as well. So if you want to see me, that's where I'm going to be.
I don't know, I every time I go out with my mother-in-law for dinner, there's some part of the meal she doesn't like though. You know? It could be dangerous.
Yeah, there is always, I mean, I will hear too, but it's good feedback for us as well. Like, I don't like the meals that have the peppers. There's too spicy, or I'm tired of the mac and cheese, or yeah, I need mac and cheese more. So there's always good feedback, and that is all taken back to OCO as well. So if you hear any of that, if you participate, or if you're out in the community at all, you know, let me know, because then we have monthly meetings with OCO to talk about the menu, to talk about the feedback we receive, to see if there's something that we can do. They do have to meet nutrition guidelines though, so some foods just have to be on there because some are higher in a particular vitamin or mineral, and there's no substitute, and if they have to meet those daily requirements, so not everyone's gonna be happy. But certainly we take all that feedback, bring it back to OCO, and they do make adjustments to menus whenever they can. So, but again, if anyone wants to step out and do that, please let me know.
I always serve at Fulton.
At Fulton, well, I'll see you there then. Our picnic, OFA picnic for our seniors is gonna be August 26th, and we're gonna be at the VFW in Mexico. We have reserved the pavilion there, hoping for great weather. So not a lot of details right now, we just secured the dates. We will be again working with the United Way, soliciting contributions or donations to help cover the cost of the event. It will be a congregate meal again, so seniors, we won't have to worry about the cost of the meal portion, but for entertainment, transportation, any additional items, we will be looking for donations in the community to cover those costs. And again, working through United Way to help us with that. And on Thursday, it'll be my first meeting, part of our age-friendly planning grant that we received. We have to go to 3 convenings with Health Across All policy workshops. Our first one is in Albany, so I'll be going there on Thursday. And we have representatives from the health department as well as the planning department as well to go, because this is, again, age-friendly planning grant. And what it's going to do eventually, when it's all complete, is to have policies that are in place for when planning goes on to, that we look at age-friendly to make sure that that planning, that community planning is looking at the age-friendliness of that. So is it on, how close is it to transportation? Does it have a grocery store nearby? Is there green space? Is there recreation? So it's looking at the whole of the community for age-friendly planning. And again, this is a initiative by the state, and once we get this in place, I think it's gonna be a star in the county's, or a feather in the county's cap, and it'll help with other grants that we do look for in the future to say that we are age-friendly county and are recognized as such. So that's really all that I have.
Alrighty, I will look for the appropriate motion.
Adjourn.
All in favor? Any opposed?